So I think a couple of things. I think there has to be a national strategy, period. There just has to be a national strategy, period. And inclusive in that is a national testing strategy that work to increase access to testing and help support build lab capacity, because as you know right now, one of the challenges is many of the private laboratories who are processing the kits, as we increase testing, they're backlogged because they're overwhelmed. And so a national strategy that provides support for those laboratories, as well as space to support other labs being able to get up to speed to match the capacity and meet the demand. As you mentioned, PPE is significant. So there's two components of that. The first one is we have to have national provisions, and forgive me, I'm blanking on the federal act. I think it's the National Production Act that increases capacity to make PPE. We should not have shortages of gowns, gloves, masks, and things like that, because we've been at this for over 4 months now. We know the need, we can anticipate the need. I see it's the Defense Production Act. Yes. So the Defense Production Act would increase production of those supplies. And then on the flip side of that is having a national strategy for distribution of those supplies to different jurisdictions that are objective and standardized and not based upon politics. I think the third component of that would be a national surveillance and data platform that allows us to be able to continue to track evidence of cases, again, and it's not informed by politics. As we've seen in a number of states, they've misrepresented data. We've seen senior data officials fired for different reasons. But if we had a national strategy and a national platform that allowed us to follow that, that is run by public health officials and epidemiologists and not political folks, that would allow for us to be able to follow this in an objective measure, be able to respond and react to outbreaks or surges in cases in a much quicker manner.